Good morning, good afternoon, everybody. We'll give a couple minutes here for people to get settled in and join. I will bring everybody's attention to the slide that is posted right now. Just as a reminder, this webinar will be recorded and the recording will be available afterwards. Just a note that your microphone and your camera will be turned off for the duration of the webinar, but you can chat and connect with one another as well as our panelists via the chat function on Zoom. We have also enabled live captions, so if you would like to have the captions enabled on your end, you can do so from the Zoom panel. Okay, since we are 1 minute after the hour, I am going to jump ahead and get started, and everyone else can continue to join. So welcome everybody to today's webinar on the critical appraisal of public health research evidence. My name is Alana Miller. I'm a research coordinator with the National Collaborating Center for Methods and Tools, and I will be facilitating our session today. Just as a disclosure, the National Collaborating Center for Methods and Tools is funded by the Public Health Agency of Canada, and we are hosted at McMaster University. Production of this webinar is made possible by financial contributions from the Public Health Agency of Canada. However, the views expressed do not necessarily reflect of the Public Health Agency of Canada. I would also like to recognize that myself, as well as McMaster University, are located in Hamilton, Ontario, which is located on the traditional territories of the Mississauga and Haudenosaunee Nation, and protected by the Dish with One Spoon Wampum Agreement. A couple housekeeping items as everybody settles in. Um, if you are experiencing any technical issues, please just try logging off of the webinar and rejoining. If that doesn't work, you can simply send a message via the chat function to Krishan Camargo. She is a research assistant here at the NCCMT, and she will do her best to help you. I recommend please connect with one another, share your thoughts and opinions on the webinar via the chat function. You can also post any questions for our presenters in the Q&A. We will do our best to answer all of your questions at the end of the webinar, but the presenters will not be taking questions throughout, so please save those for the end. And lastly, we will be doing some polling during today's webinar. You will notice a couple times that a pop-up will appear on your computer screen with our polling questions. You can simply answer those and then the poll should close. As I mentioned earlier, this webinar is going to be recorded, and the recording as well as the slides will be available a couple weeks after this webinar finishes. Keep an eye out on our social media. We will be sending out an alert when the slides and the recording are available. Okay, so with that, I will have Krishan launch our first webinar poll. Today, we are just interested to find out whether or not you have visited the NCCMT before or used any of our resources. And if you have, we would love to know how many times. Okay, so we will continue on then. Thank you everyone for completing the poll. For those of you who are not familiar with us, the NCCMT is one of 6 national collaborating centers across Canada. We were created out of the SARS epidemic and are fully funded by the Public Health Agency of Canada since 2007. Collectively, we all work to strengthen and support public health across the country, with each center focusing on a different area. So we have the Center for Indigenous Health in British Columbia, as well as the Center for Environmental Health. We also have the Center for Infectious Diseases in Winnipeg, the Center for Healthy Public Policy in Montreal, as well as the Center for the Social Determinants of Health located in Nova Scotia.
Alana, I noticed a number of people said the poll disappeared from them, and I don't know if that is something that will automatically happen after a certain time lapse, or if anything needs to be done.
Christian, if possible, do you want to try relaunching that poll again and people can continue to fill it out? There we go. So I think if you have not had a chance to answer it, you can continue to do so. Thank you for flagging, Marilyn.
Sorry, it looks like we're having an issue where the poll is ending much faster than anticipated. I think we might just have to move on.
Okay, thanks, Christian. Okay, so us at the NCCMT, our focus is on facilitating and scaling evidence-informed decision-making in public health. We do so by providing high-quality resources, real-world training, such as this webinar, as well as practical mentorship. Our goal is to advance a stronger public health driven by the best available evidence. Ultimately, we would like to improve the health and well-being of every person living in Canada. Okay, so without further ado, I will happily pass this on to our lovely panelists today. It is my pleasure to present Dr. Marilyn McDonald and Dr. Lori Weeks. Dr. McDonald is a professor and the director at the JBI Center of Excellence in the conduct of systematic reviews in the School of Nursing at Dalhousie University. Dr. McDonald's program of research is focused on the care and well-being of older adults, primarily in the home setting, contributing to mapping the terrain of safety in home care, recommending change in home care delivery, setting priorities for research, and advancing review methodology and methods. Dr. Lori Weeks is a professor in the School of Nursing at Dalhousie University and is also a social scientist and gerontologist. Lori is a core member of the JBI Center of Excellence in the School of Nursing at Dalhousie University. And in 2015, she completed the JBI Comprehensive Systematic Review Training Program. Dr. Weeks' research focuses on care and support services for older adults and their caregivers and factors affecting the health of older adults. Her research often focuses on the needs of vulnerable older adults, both in the community and in residential care settings. So without further ado, I will pass it on to Dr. McDonald and Dr. Weeks to take us through today's webinar content.
Great, thank you so much, Alana. While I get our slides up here, Marilyn, is there any other introductory comments you would like to make?
No, I don't think so. I was just going to take a quick look at the chat to see if there's anything. Yeah, I joined late. I want to make sure the mic is automatically muted. Yeah, they've been muted, so and will be for the duration of the presentation until the Q&A.
I suspect you can see my notes version, is that right?
Yes.
Okay, let's try. Can you still see it properly or no?
The notes are gone.
Can you see it? Okay, it's showing in presentation view.
It's not in presentation
Oh, okay.
view.
Okay, sorry. Let me just try that again. How's that?
Yes.
Perfect, you got it.
Okay. Okay, thank you. All right, is there anything else, Marilyn, before we get started?
No, I think we're all set.
Oh, did I mess it up again?
Yes.
Oh, okay. Sometimes multiple screens are a problem. Here, we'll just do this version. All right, are we good now?
We are.
Okay. Okay, thank you so much. And thank you for inviting us. We were asked to talk specifically about the critical appraisal process and influences on public health research evidence. So we're very happy to share information related to the center that both Marilyn and I are affiliated with at Dalhousie University, but also the broader JBI community worldwide as part of the collaboration. So Marilyn is going to talk a bit more about JBI shortly. So first of all, I'm just going to start with a few slides here. First is our acknowledgements. Alana had shared some information specific to her location. In our location in Nova Scotia, we are in the land of Mi'kmaq, and which is the Native people who have lived for time immemorial in our region in Nova Scotia and in the Maritime provinces. We also recognize that African Nova Scotians are a distinct people whose histories, legacies, and contributions have enriched this part of the world known as Nova Scotia for over 400 years. And in addition to those two acknowledgements, we also like to acknowledge the contributions of the Acadian community, who are our French-speaking ancestors who have come from this part of the world for a long time and also experienced a lot of discrimination over the years as well, and have contributed enormously to the culture in Eastern Canada. So those are some that are specific to our particular location. So today, Marilyn is going to first talk about an introduction to JBI. For those of you specifically who are not familiar with JBI, we'll give you a bit of an overview of the organization and the focus. Secondly, what is critical appraisal and why it's important? And knowing that for some of you, you probably know a lot about critical appraisal, so we won't spend too much time on that. And if you're not familiar with the critical appraisal process in general, the material will certainly be recorded and the slides available to you if you need a little bit more detail about that. I think importantly, we will share number 3, the JBI critical appraisal tools that have been developed for different types of research. And we will give examples of 4 types of critical appraisal: randomized controlled trials, cohort research, qualitative research, and umbrella reviews. And I was just reviewing my notes as well. At the end of the presentation, I didn't include it in my slides, but I will give you the very hot off the presses versions of the, if we have time and if there's interest, the tools to appraise textual evidence. I was reviewing what we were asked to talk about today, and I think that was one of the areas of interest. So we can do that at the end of the presentation as well. So Marilyn, I'll hand it over to you to talk about JBI.
Sure. So some of you may immediately wonder, so what does JBI stand for? So JBI became the official title of this worldwide evidence synthesis entity, but originally it was the Joanna Briggs Institute, but probably approximately, I'm going to say 4 years ago, in a branding exercise, that was dropped in favor of JBI. So, and if you wonder who Joanna Briggs is, Joanna Briggs was the first director of nursing at the Royal Adelaide Hospital in Adelaide, Australia, and of course, the social seat for the JBI collaboration worldwide is Adelaide, Australia. And you can see the bullets are neatly lay out a little bit about it. It's an international collaboration of scientists, health professionals, as you can see there. The vision: better evidence, better outcomes, brighter future, nice and crisp. And the mission: promoting and supporting evidence-based healthcare, which so nicely aligns with the business of this of the center at McMaster. And just to, there are in excess of 80 entities worldwide. And so just to give you a little bit of an idea where those entities are. And when I say entities, I'm referring to either a JBI affiliate group or a JBI center. And any area in the world who's interested in being an entity, you start as an affiliate group. And there is there are requirements in order to be able to qualify to apply to become a center. So hence the use of the term entity when we're referring to the number of areas around the world where there's either an affiliate group or a center. And of course, the name of our center at Dalhousie University, and every center around the world or entity are invited to select a name for themselves. And then a little bit of information about the business of JBI. And so, of course, one of the important things, in addition to being engaged in the activity of the conduct of reviews, in order to be able to even do that, there's standard learning as in terms of doing reviews. And of course, myself and Lori, we started by doing 5-day intensive workshop. And both Lori and I did our original training at the center at Queen's University. And now, of course, because we have our own center here at Dalhousie, annually we offer the 5-day training workshop, and people can participate either in person or virtually. And of course, it was always in person pre-pandemic, but we learned all the amazing things we can do virtually. And so for many individuals and for a variety of reasons, being able to participate either way it certainly has leveled and contributed to equity, I would say, in people being able to access JBI, Comprehensive Systematic Review training. And also at the JBI website, there are training going on continuously at various centers around the world, including Adelaide. And so if there's not one in your area, chances are at any given month of the year, you'll be able to find one somewhere across those centers around the world. And then, of course, when you register and participate in the training, what you're provided with, which of course is a certification in the conduct of reviews and access to the software and course materials. And the course materials are considerable, and you get a tremendous volume of information in that 5 days of training. So it's great to hang on to it because you'll often refer back to it. Go ahead, Lori. Lori happens to be a trainer in the conduct of systematic reviews, in case she does not share that with you.
Okay, is it over to me now, Marilyn?
Yes, it is.
Okay, thank you for that introduction. It's been really wonderful working with Marilyn as the co-director of our center and various other people. And yes, as Marilyn mentioned, in addition to the 5-day training that we both completed, I also did the Train the Trainer program. So JBI has a program to train people to deliver the 5-day training program. So I did that during COVID, and now I've been helping to teach the 5-day CSRTP course at Dalhousie. I think it's 4 times now, including very recently. We just completed our most recent training. So it's been great to have an opportunity to do that and be able to provide this material to lots of people who complete the training. So what we're going to talk about today is just a small component, of course, of the training, which is the critical appraisal process. But just to give you a little bit of an overview, and one of the things that I've always really appreciated about JBI is that they really focus on developing methods to synthesize the best available evidence. And in some cases, that's randomized controlled trials or other type of experimental or quantitative evidence. In some cases, that's qualitative evidence or textual evidence or other systematic reviews. So JBI currently has developed methods to conduct these 10 different types of evidence in a systematic review process. So that's one of the things that we cover extensively in the 5-day training program. But it is really helpful, even though it's not the purpose of our time today, but just to give you an idea of the types of reviews that you can conduct using the JBI methods. And it is really an advantage, I think, that there is all of these developed. I would also mention too that this is kind of the current state. JBI is certainly constantly evolving. It's a growing field of knowledge synthesis work. There's been, just since my involvement in about the last 10 years with JBI, there's been many areas where methods have been advanced in specific areas. And in the future, there could potentially be methods developed to synthesize other types of evidence as well. So to date, there has been these 10 types that have been developed, and we've included a reference here to the different types and kind of guidance on which type of review should I conduct based on the evidence available. So some of you who have completed systematic reviews or have had prior training or experience reviewing or reading systematic reviews know that there's processes that people go through to conduct reviews. With JBI, this is just the slide that shows the process that we follow, and it is similar certainly to other types of reviews and methods developed. So formulating the question, defining the inclusion and exclusion criteria, implementing a search, selecting the sources, and then completing the critical appraisal, which I've highlighted here with the arrow. So that's the component that we're focusing on specifically today. And then data extraction, data synthesis, presenting the results, and interpreting and establishing confidence in results. So I may refer to some of these other components, but we're primarily focused on the critical appraisal process, which is a required component of all reviews that are conducted using the JBI methods, except for scoping reviews, where critical appraisal is not required for conducting scoping reviews, but people could choose to do critical appraisal, but it's not required. But it is required for all of the other types of systematic reviews. So I'm going to talk just a little bit in general. I didn't want to just jump right into, okay, here's how you do critical appraisal. I just have a couple slides here about what critical appraisal is according to JBI. And this might be a review for many of you, but I just wanted to provide a little bit of context to set the stage about what we're focused on today. So according to JBI, critical appraisal is a process that assesses the methodological quality of a study and determines the extent of risk to which the study has addressed the risk of bias in its design, conduct, and analysis. And as I mentioned, it is a required component in all systematic reviews. In terms of JBI terminology, we often say systematic reviews and scoping reviews as a different type of review. So scoping reviews are not required to use, you're not required to do critical appraisal in a scoping review, but in all other types you are. There's lots of terminology referred to this, and I just wanted to say that while JBI prefers the term critical appraisal, this is also referred to as assessment of risk of bias, and it's also referred to as assessment of methodological quality. And there may be other terms that are used, but I just wanted to clarify that when I say critical appraisal, I also mean these other terms that are really analogous to critical appraisal. So why is critical appraisal important? So essentially, by conducting the critical appraisal process, you're really identifying the quality of the research that is in your review. So it's really important to be able to recognize the level of quality, because poor quality research can certainly lead to biased or misleading results. So it's really important to really have a clear understanding of the level of quality of the evidence that you're synthesizing. The aim is really to establish validity, and we want to ensure that the review is credible, and very importantly for your organization that's organizing the webinar, we really want to make sure that the evidence is useful for informing healthcare policy, clinical practice, and future research. It also very much helps to facilitate a deeper knowledge of the included studies. When you've completed the critical appraisal process, you have a very, very good understanding of the type of evidence that you have included in your review. I'm not sure if this is a good time to talk about this just really briefly. I'll probably pick it up as we kind of look at some of the specific JBI tools. But JBI, and I feel that this is an area that has evolved quite a bit over time in my experience, that JBI tends not to provide overarching guidelines about whether you should include certain studies or not based on the quality of those sources. The important thing is that when you're developing a protocol for conducting a systematic review, that you're very clear on how you're going to conduct the critical appraisal process and how you're going to deal with the results of that critical appraisal. So are you going to include all of the sources that meet the inclusion criteria, or are you going to exclude some of them based on quality? And in some cases, you can not include certain studies that are poor quality and some analysis in your systematic review. So that's getting perhaps a little bit beyond what we were needing to talk about today, but I think it's important to think about how you utilize the results of critical appraisal, how you're going to approach that in your review. And it's just really important to be very transparent about how you're going to do that before conducting the review. So with the JBI process, you establish a protocol that will guide the conduct of the review prior to implementing the systematic review. So just if you have any questions or concerns, we can probably talk a little bit more about that in the discussion at the end. But it is important to think about what do you do with the evidence from the critical appraisal process? I'm not going to show this video. Sometimes it's more hassle than it's worth trying to get video and audio working, but this is a nice little introduction by a JBI research fellow, Dr. Jennifer Stone. Just a little bit of an overview of risk of bias assessment and talking about some of the tools and structures using a JBI approach. But we'll basically talk about these things in the slides to follow. But if you wish, this is in the recording, and you're welcome to take a look at this short video as an introduction to JBI's critical appraisal process. So I told you that there's 10 different types of types of research and evidence that JBI has developed critical appraisal tools developed. We have 10 different types of evidence that we can synthesize using JBI methods. And these are the different specific types of critical appraisal tools that have been developed to be able to synthesize evidence and assess the quality of that evidence. So the ones that I decided a while ago in planning this, we'll certainly talk about I felt we didn't have time to go over all of the tools in this webinar today, but I felt that randomized controlled trials were important to look at that tool. Cohort studies was one that I know Alana had mentioned was of interest, so we'll include that one. Qualitative research I thought was very important to do, and Marilyn is going to talk about that and her experience in doing critical appraisal with qualitative research. And if there's time and interest, I find the umbrella reviews or doing a systematic review of systematic reviews is a fascinating one. So I thought that was a very different type of systematic review that we can talk about. And I didn't put a star, but I will, if we have time, talk about the textual evidence tools. And these are very hot off the press, as I did not include them in the slides, but I can share my screen and show you the tools. Previously, JBI had developed one tool for critical appraisal of textual evidence, and they very recently published 3 specific tools for different types of textual evidence: expert opinion, narrative or text, and policy. So because there's a lot of, those are very different types of evidence. So it does make sense that there were different types of appraisal tools developed. Because, for example, a textual synthesis project that I've been part of a team developing, we've just completed the final report and it's under peer review right now. The 3 tools had not been developed at that time. So we used the one tool that was available. So now there's 3 specific tools. And as I said, if we have time, I can share those with you or at least give you the link so you can find them. But I should mention too that on this slide, there's a link to all of them. And one thing that's really lovely about JBI is that even though there's various specific training where you get very detailed information and access to things like their software for conducting systematic reviews. JBI also publishes and makes freely available a lot of information. So at this website that I've included on this slide, is fully available freely to you, all of these tools, so you can just quickly access them yourself. So the list is there, and you can just click on them and find the checklist for each of these different types of critical appraisal. Okay, so starting with critical appraisal of randomized controlled trials. So jumping right in there. So this is the tool, and I think that these are the things that this group was most interested in as tools to conduct critical appraisal. So this one has also had relatively recent developments. Yeah, there has been a lot of work done on this one. So even yeah, I think that it will help to just quickly go through it and kind of talk a little bit about the structure, because there's a lot of similarities between how the tools are presented between the different types. However, for randomized controlled trials, the first set of questions, the first 6 on this slide, are really related to internal validity, and specifically the bias, assessing bias related to participant selection and allocation to groups. And again, we're talking here about specifically randomized controlled trials. So for each of the items, the way that these tools are used with JBI is that 2 people for processes of rigor with doing the conduct of systematic reviews, 2 members of the review team would independently assess each of the sources against all of these different criteria and independently identify whether they feel the answer is yes, no, unclear, or not applicable for that particular source. So each of those people do that independently, and then you compare the results of the 2 reviewers. And that is an area where the JBI software, which is called Summary, is really helpful to do that comparison. And then a third person on the review team would compare the results of the 2 independent reviewers to see if there's congruence between how their assessment, and anytime there's not congruence, that third person could make a determination of what the result should be for each of the items, or the 2 people who did the independent assessment could come to consensus together on what they feel the answer should be. So 2 people do each of these items for each of the sources. So I'll just quickly go through them. It's not, it's difficult to see where people might have questions or comments. So please do use the chat if there's any elements here that you would like further discussion about. But I think a lot of them are really relatively self-explanatory. But the interesting thing is to see what items are included on the JBI tools and what might not be here, and we can discuss that a little further at the end. So again, the first part is about internal validity. So was true randomization used for assignment of participants to groups? And there could be 2 groups, there could be a control group, a comparison group, or multiple groups. Was allocation to treatment groups concealed? So did the people in the groups know which group that they were in? That's one that I often just kind of stop briefly and say that depending on the type of study, and we talk about this a lot in the 5-day training that we do, it's not always possible to conceal which group you're assigned to. If it's a exercise intervention versus a control, or a comparison group, people know what group they were in. But there's other types of trials, like drug trials, for example, are kind of a classic example where allocation to treatment group can be easily concealed. But in some cases, it's not possible. So that could be an example where it could be not applicable if it's not possible to conceal. So that might be, for your review, if that's something that isn't really truly a measure of quality because of the type of study that it is, the type of interventions, it's not a problem that you couldn't conceal that. So it might be a choice for your team to include not applicable, for example, for that type of item. Were treatment groups similar at baseline? So, usually there's a table comparing the two groups to see if they're similar or not, if there's statistically or clinical differences between the two groups or more than two groups. Were participants blind to treatment assignment? So blinding is very important in these things. Were those delivering the treatment blind to treatment assignment? And again, that might be one where it may or may not be possible to blind people delivering the treatment, obviously. Were treatment groups treated identically other than the intervention of interest? So those are the 6 items that look at internal validity. And on my next slide, there's quite a few items for randomized controlled trials. There's actually 13 items. In addition to the previous type of validity, the second component for items 7, 8, and 9 are related to bias related to assessment, detection, and measurement of the outcome. So number 7, were outcome assessors blind to treatment assignment, were outcomes measured in the same way for different groups in the RCT, and were outcomes measured in a reliable way. So that one is really all about how were those measures assessed. And then internal validity, number 10, bias related to participant retention. Was follow-up complete? And if not, were differences between groups in terms of their follow-up adequately described and analyzed? And then finally, the final 3 elements in the tool for RCTs are around statistical analysis and validity around statistical aspects. So number 11 is always very interesting, where participants analyzed in the groups to which they were randomized. And I included intention to treat or ITT analysis in brackets here, because that's where that would become a really important element to assess if people were followed up in the particular groups, even if they had dropped out of the study, if it's possible to do that. Number 12 was appropriate statistical analysis used, and was the trial design appropriate, and were any deviations from the standard RCT design accounted for in the conduct and analysis of the trial? So those are the 13 elements, again, from the previous 6 on the previous slide, and then the following ones. For each of those elements, you would indicate yes, no, unclear, and not applicable. But in addition to that, again, some relatively recent refinements to this particular tool, which I think are really helpful. Before we had to assess these for each outcome, it was a little easier, I would say, to implement this tool. But I think that the modifications that were made more recently are really helpful, where for 7, 8, and 9, when there's different outcomes. So in a lot of cases, you're doing a systematic review where you might be interested in more than one outcome. And that's, pretty typical. Maybe you're just looking at one outcome, but in a lot of cases, there could be primary outcomes, there could be secondary outcomes that you're interested in assessing and synthesizing that evidence. So you have to respond to those items for each of the outcomes that you've included and that you're focused on in your systematic review. And then number 10 to 12 are also assessed for each outcome and result. Oh, I thought there was another animation there. So again, it does make it a little bit more complicated than just looking at 13 items for each of the RCTs that are included in a systematic review, but looking at different results and outcomes are really important. So it does make it a little more complicated to that, but I think it is really important to do that. So that's the tool for RCTs, and I thought it might be helpful to share with you an example. So this is not research that I did, but I wanted to find recent examples of people that have actually utilized these tools and published the results in the JBI journal, which is JBI Evidence Synthesis.
Lori, just before you go into that, I just wanted to add that in addition to the yes, no, unclear column, at the end of the addressing all the questions, there is a place to make additional comments about any particular study if need be.
Oh, thank you. That does remind me that yes, so in the tool, as you're doing it, you do your assessment, yes, no, unclear, or not applicable. But as Marilyn is saying, if you've been involved in conducting a review and you say no or unclear, and you have to assess many of these, or there's some time might have passed, you might forget, well, why did you say no, or why did you say unclear or not applicable, or even yes? Well, when I say yes, I don't usually provide a note, but you still could if it might have been possibly open to interpretation, I might include a note. But that is a really important point, Marilyn, because you sometimes want to provide the rationale for your response, because then if your response, if it wasn't congruous with the other reviewer, and you need to discuss it or decide what will your final assessment be, it's really useful to say, okay, on this certain page, they did refer to intention to treat, but it was very brief. They didn't discuss how they did it. So I said unclear because all they did was mention it, but not describe anything about it. So that's why I said unclear. So it's really helpful. Is that what you meant, Marilyn,
Yes.
basically? Yeah. Thank you. That is really helpful. So whether you are kind of using the tools on your own outside of the summary software, making notes about your assessments are really helpful. In the summary software, JBI software, there is a place to add those comments. So yeah, it saves a lot of time in the long run, for sure. And they do recommend write the page number, say on that page and what page it was where you found that information and why you made that determination. Yes, thank you, Marilyn. So yeah, if you wanted to look this up, I have included the reference. This is just a screenshot, but the reference is at the top and the full reference list is at the end of our slide. So you're welcome to look at an example of a systematic review of our CTs that included meta-analysis. Our focus today is on the critical appraisal process and not the results of the meta-analysis, but if you'd like to see an example, this is a good one. But I did include a screenshot of the critical appraisal that was included in this review by Serena and colleagues that was recently published. So I just thought it would be helpful. The content of it isn't really our focus today, but just to show you how this is a standard way of presenting the results of the critical appraisal tools. So this is a study that I believe in this study there was different types of sources included. So these were, which can sometimes happen in systematic reviews, but this was in this table was ones that were specifically parallel group RCTs. So they've grouped those together and just looked at the quality of those particular studies that were this particular type in this review. So one thing I find kind of interesting, I'm not sure, Marilyn, if you have comments about this, but JBI doesn't really say very, very clearly about how to score it, except they want you to say yes, no, unclear, or not applicable. So in this one, what is kind of interesting, and this was published in JBI Evidence Synthesis, it was peer reviewed and approved and all of this, they decided to give 2 points for a yes, and 1 point for an unclear, and 0 points for a no, which I find kind of interesting. So anyway, the point is that JBI doesn't specify how you assign points per each of those different responses, but they chose to give 1 point for it's unclear. I know that in other cases, sometimes you just give 1 point for a yes, and that's it. But I think in some of my examples, I think I do have other ways that people have chosen to assign points to the different responses. But the concept is that it just needs to be very transparent and clear how you're doing the scoring. So in this table, they chose to use the letters for yes, no, unclear, or not applicable. None of them in this case were not applicable, but then did their own way of calculating it, which was really kind of interesting. So JBI does recommend that for each of their sources, so in this case, was it 13 or however many there are on the left-hand side there, and for each of the items along the top. So they chose, like as I said, you want to include the information for each outcome. This is possibly a study where there was one specific outcome, but you could potentially include very specific information in your tables if you wish about different outcomes. You could have a different table for different outcomes, for example. What else should I point out here? Often people do, for ease of being able to kind of take an overall look at the quality of the studies, we do often include summary scores. So these authors chose to do a score for each individual source. So you can see in the rows, the first one scored 12 out of 26, and the last one scored 13 out of 26. So you can see for each individual study or source, you can see the quality really clearly. But importantly, you can also see it by item. So you can easily see that for item 4, every single study scored a 0. And typically, even though there are standard tools, often at the bottom in the notes, we make sure that the items are also included, which is actually really handy because as there is new versions of the tools refined, it is really helpful to be very, very clear on what question 4 refers to when this particular study was conducted. So this is one where question 4 was for participants blind to assignment, to treatment assignment. So this was a case probably where it wasn't possible in this type of intervention. So that's a place where I suspect for this particular study, even though none of them did that, it's really contextual about the type of evidence you're synthesizing and whether that's even important. So that wouldn't be identified probably as very problematic in this particular type of intervention. So it's very contextual how you kind of take a look at the critical appraisal results and how you prepare the tables and then the summary. So with JBI, they always, it's required to include a table like this. But as I said, there's sometimes different ways of calculating and scoring and presenting, but something like this where they do like to see each of the sources by each of the items, and then you get a really good individual results from each source and then an overall assessment of the total. So I've also included a screenshot again from this particular reference of just an example of how JBI recommends you write a narrative about the critical appraisal process. So this was a bit of a complicated example because there was many different types of evidence that were synthesized, and they did the critical appraisal by different designs of RCTs. So I think it was table 3. So for parallel in the previous table, previous slide. So in partway through that left column for parallel group RCTs in table 3, scores range from 12 to 22 out of a maximum of 26. So you get an idea of the level of quality according to their scale. So somewhere on the lower end, somewhere on the higher end. So you kind of get a summary there. And then let's see, I was going to point out something. Then later on in the second column, again, it's a complex systematic review with all the different types, but they might identify certain components of the critical appraisal process that were really relevant to this particular review. So example, they're talking about randomization, how randomization was achieved. I do find it quite common. They do comment that in many cases, the authors of the individual sources didn't specify how randomization was achieved, and that's something that they really identified in the narrative, that was a problem with some. They mentioned things like in some cases, they reported really clearly withdrawals and dropouts, but in other cases, that wasn't really clear. Intention to treat analysis was something that was raised that was not a strength of these particular sources. Blinding. So all of these kind of elements, you kind of highlight what was the overall assessment of the quality of those studies, and then what particular components were really relevant to give the readers an idea of the quality of those particular sources that were synthesized. So this is a narrative summary of that. And for the RCTs, I thought it was also useful, and Marilyn, you might have some additional comments because you were really good at doing the summary of findings tables. So with JBI and with other types of systematic reviews, um, there's emphasis on, with this particular type of evidence of RCTs, to do summary of findings tables, but not just for RCTs, for other types of reviews as well. So this is just an example from this this review, and I've just highlighted here some of the elements that have to do with the critical appraisal process. So this is where you would identify the outcomes that you were focused on in the review. What is the evidence? How much evidence is there? What was the sample sizes? So you get a sense in this overall summary table of what evidence was available, what were the key results, and then really based on the quality of that evidence, how confident are we in the results? So I just highlighted with the arrow at the bottom that the risk of bias was downgraded 2 levels because of concerns around selection bias, methods of randomization, allocation concealment were not stated. So basically, because of some of those elements in the critical appraisal process, the certainty of the results were presented as low. So essentially with this process, it starts at high, and then as there's concerns, you downgrade those to other levels. So this is just a tabular way of giving an overall assessment of the results and the quality of those results, and then what does that mean for the implications of the study using this particular approach. Marilyn, I'm not sure, I know that you've done this a lot for other types of evidence as well, but did you want to say anything else about these summary tables?
Just to add on, Lori, is how it always strikes me after going through all of the review work and populating the first table that you showed gives you part of the portrait. But then when you get to this one, you can really see how you build to provide this evidence or this information. And it, to me, for anyone, whether they be clinician, researcher, policymaker, I find that it really is very helpful when you see what the review produced.
Yeah, for sure. Wonderful. Thank you. So yeah, I really like these summary tables, using the grade approach in particular, and other types of research synthesis use something similar as well. It's really a summary of the entire systematic review. So great. Thanks, Marilyn. Okay, so another example, because this is one, Alana, that you had mentioned, people were interested in tools to do critical appraisal of cohort studies. So I've included, just let me double check. Yes, there's just 11 items. So it's very similar in structure. There you respond yes, no, unclear, or not applicable. 2 people do them independently and then compare the results and come to a consensus on the final outcome for each of the items. So I'll just briefly go through these, and you can kind of identify ones if you want to have further discussion about those later, because these are certainly different types of studies than RCTs. So were the 2 groups similar and recruited from the same population? Were the exposures measured similarly to assign people to both exposed and non-exposed groups? Was the exposure measured in a valid and reliable way? Using gold standard or tools that have very methods that are not biased or have very good psychometric properties, for example. Were confounding factors identified? So when in the training we just did, actually, a really interesting example was a study that it was about smoking. What was it now? Oh, there was assessment of smoking, but not it was about alcohol consumption, but there was confounders related to smoking, which weren't assessed. So that was a study. It was just an example that there could be confounders between alcohol consumption and smoking. So that's just an example of how you want to think about what has been assessed and what might be missing, and were there confounding things that could affect the results that weren't accounted for in the study. Number 5 were strategies to deal with confounding factors stated. In a lot of cases, those would be statistical ways for dealing with confounders. Were the groups or participants free of the outcome at the start of the study or at the moment of exposure? Were the outcomes measured in valid and reliable ways? Was the follow-up time reported and sufficient to be long enough for outcomes to occur? That's always interesting because when you look across different studies, there's often so many different time periods that are reported, which is really fascinating. But that's important to assess. Was follow-up complete? And if not, were there reasons to follow up described and explored? Were strategies to address incomplete follow-up utilized? And was appropriate statistical analysis used? So those are the 11 items. And I wanted to mention too, Marilyn and I were discussing this earlier today, that there's these checklists, and we don't have time to go through each individual item in detail. However, on the link to JBI's website, where they include all of the critical appraisal tools by type of evidence, the tools include a really nice appendix where each of these items has a lovely paragraph, and sometimes it's quite long. So as you're reviewing, assessing different studies and applying all of these criteria in the checklist, sometimes it's like, oh, well, this element part of that, or was it part of that? Having that in front of you while doing the appraisal, having that more detailed description of each of these items is really helpful. And that is freely accessible at the link that I shared for all the critical appraisal tools. It's really helpful as you're going through the items, because to keep them all straight and to be doing them as consistently as possible, obviously, as you're going through different sources and different people doing the critical appraisal. So those are really helpful to keep at hand, and those are all there on the website. So this is just an example. I thought it might be difficult. I added this slide really recently, but to find a JBI example published in JBI Evidence Synthesis of Cohort Studies, this was actually kind of an interesting one about incidence of severe infection in patients with rheumatoid arthritis by taking biologic agents. So looking specifically at rheumatoid arthritis, there was actually 52 studies that were cohort studies included in this particular systematic review. Now, this table is just the second part of the table. I didn't include all of the results, the critical appraisal results, but I included the bottom of the table because it has some of the summary results. So in this case, you can see some of the outcomes of all the 52 studies. Again, these are just the last few alphabetically, but in some cases, even across all of those 52 studies, there were some items where there was a yes result for every single one. So several of them achieved 100%. So for example, for this one, again, the items are included at the bottom, so there's no confusion about what the numbers refer to. So Q1 were the two groups similar and recruited from the same population. That was a yes for every single study in this cohort's synthesis project. Question 2 was also 100. Were the exposures measured similarly to assign people to both exposed and non-exposed groups, and so on and so on. So you can see which ones. This one, when you look at the different items, they were really rated quite high in terms of the quality of all of these 11 things in the checklist across these 52 studies, the lowest one being 71%. So you can see, as I said, there's different ways that JBI doesn't require you to score them in exactly the same way, other than make sure you use yes, no, unclear, but the numbers you assign to that can vary. So these researchers chose to use percentages and say, report it as a percentage of how many of them reported a yes. So that's a kind of another interesting way to report them. But again, it just has to be very transparent and very clear how you are doing that calculation and how you are reporting those things in the tables. And again, like the RCT example, in addition to the tool, you would have usually a relatively brief section of the final paper where you discuss, again, the overall assessment of the quality of the critical appraisal results, and then any particular items that might be really important to really highlight in terms of the critical appraisal. So as I said, for this one, the results were really quite positive in terms of the quality. I did find it interesting in this narrative that one thing that they identified, and I think this is really important, that they identified the issue that how the accuracy of the diagnosis of rheumatoid arthritis was not something that's captured in the JBI critical appraisal tool. So for cohort studies, but maybe for this particular health issue of rheumatoid arthritis, there's different ways of assessing, and they identified in their narrative that even though these were studies of people with rheumatoid arthritis, there was no particular way to assess with the tool to ensure that these people had a clear diagnosis of rheumatoid arthritis. So I thought that was a really interesting thing that they identified in the narrative around this. And that is something that's not in the critical appraisal tool of how was that diagnosis determined. So that was something really interesting to me as I just scanned through what did the researchers note about the methodological quality. So then later they talk about, were there issues around confounders, things like that. So you can see that you do the table and then you do there's always a narrative summary of the critical appraisal process. So Marilyn is I don't know if in the introduction, Marilyn, did they talk about your expertise in qualitative research? Marilyn has a lot of different research skills and has led many different types of systematic reviews, but one of her areas of expertise is qualitative research. So I used your example from a study that you completed. Excuse me. So I thought it would be helpful for you to go through this component. So I'll advance the slide so you can talk about the qualitative critical appraisal process.
Yeah, and Lori, I'm just noticing we're already at 1 minute past the hour, so it's amazing how fast an hour goes. But certainly from the tools that Lori's already reviewed with you, you have a sense of the structure of JBI's tools. And in qualitative studies, so of course, philosophically, you sit in a different place if you're doing qualitative research versus quantitative research. And so I'll point out to you, there are 2 or 3 questions in this critical appraisal of qualitative studies that typically it's rare that you actually see them addressed in a published paper. And so in all fairness to authors of these sorts of studies, it's not uncommon that if you actually address this in your published paper, sometimes the journals will not. They will ask you to remove the section. And so I just want to, I'll point those questions out to you. So for example, is there congruity between the stated philosophical perspective and the methodology? And typically, although they may not explicitly talk about that in their paper, when they talk about the methodology and the methods they're going to use, that's where your answer will sit to that question. And so, for example, if you want to, I'm trying to think. So if you want the perspectives of individuals on something, there are such things as surveys, which is one way, but typically the person in a survey is going to be bound by the questions asked in the survey, as opposed to them being able to actually share what their experience has been. And so typically your interview or your focus group is going to get at that. So always be mindful when you're looking at a piece of qualitative work. First of all, if they just say we did a qualitative study, that automatically your antenna are up, because as in quantitative work, they all have their particular design. And so in qualitative work, it's no different. You use a particular design. So if they haven't identified that, that's problematic, and likely you're going to have trouble to address the remainder of the questions in relation to the critical appraisal. And then is there congruity between the research methodology and the question and or objectives? So for example, if the question is all about the perspectives, or sorry, if in the research question they're talking about cost analysis or effectiveness, and the methodology is phenomenology, then it's impossible to be able to address those things by doing a phenomenology. Is there congruity between the research methodology and the methods used? And again, you're always thinking about, so if they're doing a grounded theory, what sorts of methods are they talking about using? If they're doing phenomenology, what sorts of methods? And so you're always, typically, you're going to have participant observation, you're going to have interviews, you're going to have focus groups. There can be photo elicitation with some of these as well. And then is there congruity between research methodology and the interpretation of results? Number 6, is there a statement locating the researcher culturally or theoretically? This is one that I don't commonly see this addressed in a qualitative study. And I know because it's happened to myself. Typically, when I do a piece of qualitative work, I include a brief 3 or 4 sentence paragraph in which I do this, but almost invariably I'm asked to remove it when submitting for peer review and publication. And I usually try, and in my response to review, explain this, and I'm successful maybe 50% of the time. And also, is the influence of the researcher on the research and vice versa addressed? So in other words, if in starting my study, I hold a certain perspective and anticipate that this is what I'm going to find, have I made that explicit? Because sometimes in the conduct of any research, no matter what we do, but in qualitative work, it's not uncommon to impose what you anticipate on the findings, as opposed to letting the findings speak for themselves. Are participants and their voices adequately represented? And this, of course, when people include illustrations, they come up, for example, with a theme, and then they put quotes in to support the theme that they've come up with. And so look closely at what they've used as their illustration, and does the theme that they've used, do you see a fit between the illustration and the theme as identified in the study? And of course, is it ethical according to current criteria? That one is fairly straightforward. And then number 2, do the conclusions draw on flow from, the analysis and interpretation? And of course, there's always the temptation to go beyond what the data actually stated, or at what you actually found. And so that's a good thing to be on the lookout for, because as tempted as we'd like to think that this is what people meant, if it's not clear that that's what they meant, then we can't go there. So numbers 1 and 2 and number 6, those are the ones that I typically find that the more often than not, the answer is no, but, yeah. I don't think I'll take any more time than that because we have a number of questions, Lori, in the Q&A, and some of them are pretty darn good. Well, all of them are good, but some of them more pressing than others.
They really are good questions. I agree. As you were speaking, I was taking an opportunity to review, but I'll just quickly flip through a few slides and we'll definitely, talk about some of the questions because they're excellent. But this is a screenshot of a study that Marilyn led that I was very happy to be part of the team. It was the first qualitative systematic review that I was part of. And you can see here some of the items Marilyn was talking about, how some of the things are less evident than others. One of the items in the anyway, I'll just talk briefly about a few things and then we'll definitely get to the discussion. I don't think Alana, you had asked us to talk about this, but I just find it kind of fascinating that JBI has developed a critical appraisal tool to assess systematic reviews. So if you're conducting a review of reviews or umbrella reviews, they're sometimes called, where all of your included sources are systematic reviews, there's a tool that JBI has developed, including one of the items, very interestingly, number 5, is did the researchers use a critical appraisal process and report that in doing the systematic review. So that's item number 5. So that's one of the items that to look for. So again, this is just an example. If you're interested in taking a look at a recent JBI umbrella review published in JBI Evidence Synthesis, you can see the different elements, and again, very similarly how they're reported for individual sources, and then you get a really good sense across all of the results for the quality of those reviews that were included. Let's see, number 5 and 6 were 0. So this was, interestingly, in this review, there wasn't any of the sources that were included that were systematic reviews that had conducted a critical appraisal process. That's really strange, but an important thing to document. So I've included our references here and our contact information. But yeah, I think I'm going to stop sharing my slides now, and we can talk about some of the wonderful feedback that's included there. I know that one of the things we were asked to do was talk about textual synthesis. So and one of the comments was about that. So I'm just going to briefly show you, again, very hot off the presses with JBI. Oh, golly. I'm going to have to share my screen though. That would be useful. Share my screen. Okay, this one. I won't take very long, Alana, to just show this, but again, these tools are fully available on JBI's website. So JBI has really recently, instead of one checklist for critical appraisal for textual synthesis, they've divided it into 3. So we now have narrative, expert opinion, and policy. So there's checklists developed for those. They're relatively brief. It's really very interesting. So this is an example where there's a lovely document for each of the different types of tools. They include the checklist. And then, as I said at the end, there's nice description. This is a relatively brief one. Most of them are a little bit more detailed than this. So this is a really brief 6-item checklist for looking at just narrative evidence, or sorry, textual evidence that's just narrative. So is number 1 is always a very interesting one. Is from a credible source, essentially. Anyway, you can see those items that are there. So there's one, as I said, for narrative, date, text, expert opinion, and policy. So those are available to you on JBI's website. So for, I think it was Janelle in the chat was looking for that information. So it's not in the slides, but it's available in the link that I have on the slides about the different checklists that are available. So Alana, did you want to facilitate the discussion of what you'd like us to talk about from the chat?
Okay. I
Yeah,
think,
well, can you guys hear me okay?
yes.
Perfect. Okay, good. Sometimes my headset.
Oh, you just went silent.
Mhm.
All right, am I back now?
You are.
I knew that was going to happen. Thank you both for taking the time to chat. That was very interesting. I think since we have about 15 minutes left, I'm going to go with the questions that seem to have the most upvotes here. I am just going to start with something that was in the chat. You mentioned JBI summary software. Could you touch upon that a little bit more? And if there are any benefits to using that software?
Oh, sure. That's really helpful. I'll try to focus on critical appraisal because there's so many elements of the software. Okay, benefits. So when you're in summary and you're doing critical appraisal, you basically select from a drop-down menu. So whatever, so if it's a textual source or it's an RCT or a cohort study, you would basically select which one, and then it will populate the screen with the different items of the checklist that you need to assess. So that's lovely, and it's all there for you. And
It
then
generates the table afterwards, Lori.
oh, yes. Once you have the two people in, so the two people doing it independently, then once that's done, then a third person or the two people can do it together or a third person. And it's beautiful. Like the results are right beside each other. So you see person one, person two, if they both said yes, then the end result, the final agreed upon result is clearly a yes. But if one said yes and one said no, that's highlighted. So you see you have to have a discussion to determine it, and it's right beside each other. So it's really, really nicely organized. Of course, you could do that by hand. You could have one person fill that out on a paper sheet or and then another person, but just the way that the comparison and then having what is the final agreed upon decision for each of the items, for each of the sources. And then, as Marilyn said, once you've done that consensus part and you did your final assessment, then it develops that final table for you. So all of your results are organized really easily with the click of a button. So that's what I remember, Marilyn. What else do you remember around, especially critical appraisal?
And of course, the caveat that we talked about earlier today, if it's a mixed method study, you have to critically appraise both the qual piece and the quant piece. But summary will only accommodate one appraisal per study. So of course, then you'll have to do the other one outside of summary. And then once your table's populated, then you have to add those additional assessments to the table.
Great. Okay, switching gears a little bit here. We have a question that states, as knowledge users, we are interested in using the JBI tools to appraise evidence we are using to inform practice decisions. It would be helpful if you could provide more information about scoring when it is not part of a systematic review.
Oh, that's really interesting.
Yeah.
I'll start, Marilyn, but feel free to chime in there. I guess my official response as a certified reviewer and trainer from JBI is that the tools have really been developed for the context of conducting systematic review work, where you're looking at the quality across multiple sources. However, so taking off my JBI hat, you could also use these checklists to look at, if there was an important study published that was really relevant to your practice area, yeah, like unofficially, you could certainly use these tools to say, I mean, JBI officially would say that no one study should inform policy or practice on its own, that you really should look at the broader body of evidence. I am not a nurse, though. I'm in a school of nursing and I am not a nurse. Marilyn has a ton of clinical experience. So I'd love to hear what she has to say about that.
So absolutely. In fact, I guess you would say, I've actually done that in clinical practice. So you're trying to make a decision about how to proceed. And not always as an individual, usually there would be 2 or 3 of us clinical folks. And of course, we landed on, again, usually you're in a situation where there's not a lot of studies. And so each of you take and use the tool just like we showed today. And so if there's 3 of you and you have 3 or 4 studies, then if you can spare the time then and there, carry out the exercise. I realize it's, it's definitely not. And you have to remember that yes, you have done this appraisal, but it is just what you were able to do in that moment in time. And you're using it as a way to help you make a decision clinically. And usually you're only going to do it because you're faced with needing an answer sooner rather than later. So, do I think there's benefit to doing it that way? Yes, I do.
Great. Okay, another question here. Can literature reviews incorporate multiple study designs? And if so, what kind of critical appraisal tool would be recommended for this kind of study?
Again, the term literature review, so it really was the term up until, I suppose probably the advent of Cochrane in 1992, and then JBI in 1996. Because then we moved towards this systematic way of looking at the evidence. And so if the person says they're conducting a literature review, you would need to define the scope of what it is you're doing, would be my thought, Lori. I don't know. What are you thinking?
Okay, so I guess so JBI has a type of review called mixed methods review, and Marilyn has referred to that, although I didn't include the tools because so that's a type of JBI review where you include both quantitative and qualitative evidence. So you would include the checklists that basically reflect the quantitative or qualitative evidence that you have. That's the only type of official JBI review where you would be using different forms of evidence. But I'm not sure if I'm answering the question. I don't know if I totally understand it, but in some of the quantitative, so there's only one qualitative tool. So as Marilyn talked about that one, there's multiple quantitative tools. It's possible that you would have different types of quantitative evidence depending on your purpose, the design, the inclusion criteria. It's possible that you'd have more than one type of quantitative sources or types, and you could use different JBI tools in the same review. Does that make sense? Depending on the type of sources that you have. So you could have different tables reported using different tools. That's possible, depending on the type of review.
Yeah, so just to clarify, Lori, I think what you're saying is if you were doing a systematic review that included both RCTs and cohort studies, you would appraise those using the corresponding JBI tools and have separate tables for both types of studies.
It would be a little bit unusual because usually your review question is very detailed using a specific, we didn't talk about the frameworks and acronyms used to guide the reviews. So formally in a JBI review, you might have, it wouldn't be too uncommon to have RCTs and quasi-RCTs, for example. Like as I showed you in the examples, you can, like one of them was just cohort studies, right? And one was just RCTs. So but in any case, the tools are there. You need to match the design to the right tool, I guess is kind of the end result. And it is possible that in some reviews you might use more than one tool. In the mixed methods for sure, and possibly in some of the other ones. But usually the review questions are very specific. So you often don't have too many different designs included in the same review with JBI.
Hey, we have a follow-up question from Jackie regarding the question about using.
About using what? Oh, you went silent, Alana.
Hopefully I'm back now.
Mm. Yeah.
Jackie's follow-up question regarding critical appraisal in practice. Is it 1 point per question? Would you say questions are equally weighted?
Oh, that's interesting. Um, it, it depends. Like there's some studies where a particular item is very important to that particular design of study or type of source, whereas other ones might not be as important. So JBI doesn't predetermine. And a very interesting thing, I don't think I actually said this, is that when I did the CSRTP training in 2015, there was a little bit more of an appetite there where you could select the best evidence, the best quality evidence to include in your systematic review. So you can use the critical appraisal tools to say we're only going to include studies that are the highest quality, and these items are really important for our review. So if they don't meet these criteria, we're not going to include them in our review. That I find that things have changed a little bit over time. So you can choose to exclude sources based on the critical appraisal process. I find that these days there's a bit more appetite to basically include the whole body of evidence that meets your inclusion criteria. You still report the quality of it. I find that there's less exclusion based on quality of the studies, but you account for that in the conduct of the review, and there might be some, you might exclude the really poor quality studies from certain analysis, perhaps, or not use those studies to inform practice if they're really poor quality. What would you add to that, Marilyn?
Yeah, actually, that review that we looked at earlier, the qualitative one, in that one, with the exception of the 3, I think, points that I pointed out that really typically aren't addressed directly, I required all the other 7 to be yes in order to include those studies. And as you stated earlier, Lori, the transparency around your include. So if you had a cutoff of any sort for including studies, then you have to be very clear about what that was and how you arrived at that decision. But you're right, JBI does not, they're silent on a point system or a scoring system. The direction is that you be very transparent about everything you do.
Okay, and I think related to that point, another question. If we were to establish our own criteria for scoring, is this considered an adaptation, and would we have to ask permission to adapt the tool?
The short answer for me would be no. They're publicly available on their website. So once an individual chooses to use them, again, I would expect that the individual, however they use and whatever they publish, would provide that information.
I didn't really do this on purpose, but in the examples I included, you could see the tables, and different researchers chose different ways to calculate them. So one might say there's 10 items, I'll report it out of 10. Another person does it as a percentage. So that's kind of an example about, you would have to do it consistently in that one review, obviously, and report that very clearly. But it's fascinating to me that different researchers, decide in a way, are they going to count that as a yes is 2 or a yes is 1? You just have to do it the same way, in the study. But it's really kind of interesting that there's different ways that we even do that, like as long as it's clear and consistent. Yeah.
Yeah. There was a question around Cochrane and JBI and comparisons and risk of bias versus critical appraisal. I've actually used both. I think for me, the important thing is learning about and understanding both, and then make a decision about, like I don't have, in terms of, when I look across the palette of tools for JBI and the palette of tools for Cochrane, there's tools in one that I might work more readily with than another, but I don't have a particular problem with the set of tools from either of those evidence synthesis organizations.
Great. That was going to be my next question. I do think, however, we are pretty much out of time. So just to wrap up, I want to say a big thank you to Lori and Marilyn for joining us today. Also a big thank you for all of the participants for attending and all of the amazing questions we got. Unfortunately, we didn't have time to get through all of those questions. But if you are really, really dying for an answer, please pass them along to us at nccmt@mcmaster.ca, and we will make sure those get answered. Also, just as a reminder, the slides and the webinar will be posted, so you will have access to this information again. And keep an eye out on our social media for an alert for when this gets posted. So again, thank you, Lori and Marilyn, and thank you everyone for attending. I hope everyone enjoys the rest of their afternoon. Thank you.
Thanks, everyone.
Thank you
Bye.
for inviting us. Have a great day.
Okay.